heart attack pain can never be pinpointable. So somebody says, I'm having heart attack here, like this. If he comes, it is never heart attack. Heart attack cannot be pinpointed. That's the universal fact.
I invite all of you to join the run on 21st September organized by Cardiac Rehab. Why is this important? Cardiac rehabilitation is a very new concept in India, and it's an extremely important concept. Far too many young people are suffering from heart diseases today. And those who do actually then somehow feel that this is the end of their active life. And that is simply not true. What cardiac rehab has shown is that you can lead as good a life, perhaps even better life than you led before your heart attack and your problems. Now, if this is what happens to people who have actually suffered a heart problem, think of how much better life will be if you prevent cardiac arrest. So I urge all of you to join this and to spread the word about cardiac rehab. Thank you and all the best.
I and we from Social Venture Partners Hyderabad are so proud to be associated with cardiac rehab. I've heard innumerable stories where we crib about how the doctors and hospitals are fleecing. And here we have a doctor who is working overtime to give the benefit of natural healing to the patient suffering from the cardiac issues. Every time I meet him, we hear a new story and how that has transformed the life of people who have been suffering with this disease for a long time in a matter of few weeks or months or a few months. And it amazes me that so much of difference is made by this organization and so few people are aware of it. I would strongly encourage, if at all this message reaches you, to please be part of the run that is happening on 21st September. Become a part of this organization and support it and just spread awareness, and that would be fantastic for a whole lot of people who are suffering from this disease. Thank you and all the best to Cardiac Run.
Tilted to left? Somewhere here? Left. So, do you think right side also happens? Heart attack pain? Do you think right side heart attack pain can appear?
Never heard of it.
Never heard of it. So heart attack is majorly on the left side, but it can be both sides, it can be right side alone, and it can be even center also. If it is a right side and all center, common healthy man can ignore, but somebody who's a smoker, any side on the chest, he should be on alert. Okay, that is about the side. And when it is the left side, it is always the chest area, shoulder, arm, up to the fingers, little finger, neck, jaw, ear, up to this area, there will be pain. Okay, that's a broad area. Heart attack pain can never be pinpointable. So somebody says, I'm having heart attack here, like this. If he comes, it is never heart attack. Heart attack cannot be pinpointed. That's the universal fact. Okay, because it's an internal organ pain. When it reflects onto the surface, it comes as a broader area. But so many people come, I see, say, hey, exactly here I get some current like shock feeling every time here. So pinpointable heart pains are never heart attack. It's a broad area. Now, according to you, which character of the pain, how would it looks like? Everybody have experienced a lot of pains in our life. According to you, what kind of pain is heart attack character? Like burning sensation, current shock? Guess.
I don't want to guess.
Just give guess. I'm assessing your knowledge. So you need to act tomorrow. How does a heart attack pain look like?
Is it like contractions?
Okay. So pain characters is like, you can see everybody experience what is pin pricking. Everybody experiences squeezing type of pain, throbbing type of pain, all these type, no? What it could be according to you?
Squeezing type of pain.
Squeezing?
Kind of
Exploding. Okay. The best scenario is if you lie down and the elephant comes and puts its legs on your chest. How do you feel? Heaviness, suffocating, breathlessness, sweating associated with it. This is the typical type of heart attack pain. Current shock like never heart attack. Comes and goes fraction of second. Hey doctor, I always get some electric shock here. this timing, that particular timing, after eating, a fraction of second electric shock are never heart attack. Okay, so I'm trying to explain you which are not heart attack also. Pinpointable is not heart attack, electric shock, fraction of second, here and there coming and going. No. Because a heart attack, heart starts aching or complaining when there is a blood flow reduced. So it will be comes as a small and grows bigger and bigger and bigger with time dependent, and it grows bigger in area. It will be like that. That's the reason why when heart attack is happening, people ask don't walk, because you are adding additional load for the heart too. So it keeps increasing. So clear? The side of the heart attack pain is left side, can be right side or both sides, but never ignore if somebody having a lot of risk factor like smoker, drinker, diabetes, everything. Okay, and duration of the pain, it starts slowly and grows bigger, and things which are not. Sometimes when you go to gym and you did a lot of exercise, the next day which side will pain? The left will pain, because most of the people right hand persons. So like I did bench press, lot of youngsters come bench press, push up, something you did both. By nature we are right hand person from childhood, so bucket, lifting, this all what happens, we use right hand. So by nature our right hand, shoulder, chest are stronger. So when you do an equal weight of dumbbells, push up, na, this will not pain next day, this will pain, and they come and say, doctor, if I do like this I'm getting heart attack, if I do like this I'm getting heart attack, if I do like this I'm getting. These are all not heart attack. Movement related are not heart attacks. Okay, it's all from the chest fall. Now it's clear. Most of the people, because as I said, you had no clue how a heart attack pain look like. I have seen people in postmortem reports where a person died of heart attack. When they entered the room was smelling jendu balm. The reason is he is not aware it is heart attack. He is applying jendu balm, thinking that it is a simple pain. So that's how lack of awareness. If you don't have an awareness, the duration, side, the character of them, we may ignore those symptoms. Now that you identified heart attack, now what next? So heart attack is a time dependent. Means once you have to act very fast. So there are two types. Many of you have seen social media, na? Suddenly collapse. That's called sudden cardiac arrest, and the person is unconscious. Oh, no, sudden cardiac arrest doesn't cause any pain. Suddenly collapse. And the second one is where some of the territory, we have three major vessels, some of the territories got blocked, so that part of the heart start complaining, squeezing, pain come. So you have ample of time to complain, tell your friends, call a friend. Even you can have sometime travel up to the hospital, you talk to the doctor also, yeah, I'm here, they will do blood test, they do ECG, they will go to angioplasty. Till that time you are talking only. So these are different types of minor heart attacks. And sometimes time dependent. Minor can become bigger as travel time delays, all this. So it's a heart attack is a time dependent treatment. The early you act, get the best treatment, the faster you come out from a major damage. Because the heart is a muscular pump. As it loses the amount of muscle, the heart becomes weaker and weaker pump. And for such a height body, today I'm a 4 HP motor, tomorrow in half an hour I'm a 2 HP motor, it can't suffer. Ne? So all people may deteriorate a lot. So to prevent a major injury, we have to act fast. So how do you act in these two scenarios? First, a proper chest pain. He has a chest pain and you are now that you are educated, you know what is a heart attack looks like. You have to give this medicine, which is called clopidogrel, aspirin, and atorvastatin. These three tablets in a proper ratio, we have already made it. All you have to do is open this kit, consume all the tablets, put it in the mouth, chew it till become powder, and drink water. Why can't we swallow it? Swallowing, digestion, absorption takes hours. So to prevent that, we are bypassing by entirely digesting in the mouth, so that the blood supply in the mouth will is enough to absorb this drug and act fast. That's why we have to chew this in the mouth and drink with water. Chew as much as possible. Okay, then you are gonna save a heart attack from progressing or worsening. Or even such person who goes with this kit and go to emergency, they'll say, "Oh, who gave you this medicine?" Because this is the medicine they give after you reaching there. So you have saved a time. So these are medicines which I want everybody to have in their pocket, purse, car, wherever it is, in the office, so that you're gonna save somebody's heart attack, because it's a time dependent. Okay. Second scenario is suddenly collapsed. Can the collapsed person chew the tablet? No. Now the heart has stopped beating. There is no pump. The first thing heart may be beating in a slower or abnormal current. Some beating is there, but blood flow to the brain is gone. So you have to act fast. The first thing you have to do is CPR. So you are mechanically compressing the heart so that some blood continuity is going, and then, but to more than that, what you can have is automated electrical defibrillator. Very simple method. All you have to do is, the moment somebody collapse and you know it is he complained and collapse, all you have to do is just simply open this, and there are two electropads. Stick it as per the direction here. It will give the shock by itself. It only will analyze how much shock to be given. Shock to be given or not, it will decide and put it. So all you have to do is just open and snap. And if the person doesn't need shock, it will keep telling, please continue CPR. That's it. So this in that patch, you have to open that patch and stick here. There is a diagram also in that how to put direction.
On the left side, both.
Yeah. Basically heart is there, we want to pass current from here to here, so two patches will be there. So current passes between the two patches, heart is in the middle. It gets like, it's like you bend a scooter and start it, it starts off. So heart has a property where it can restart by giving shock. We can stop deliberately, we can restart. So the on base, I think it's 2 lakhs somewhere, 1.5 to 2 lakhs. This chiller will cost that much, and it comes with the battery for 5 years, so that's a good one. So AEDs are something which I want to be in every offices, because it's gonna save a life. Yeah, societies also, they need to have it everywhere. Because see, if you call an advanced ambulance also for a collapsed person, you are wasting time. Advanced ambulance also comes with defib only. Who will wait for that? If you have it, you go and put it. You are not doing any mathematics, where to put, how much to give shock. In cinemas you can see, people will do this rub and put a chest shock. That is all calculation method. Now this automated method will do its own shock and restart the heart. You're gonna say it's a matter of 2 lakhs, layman language, easy to execute. So I want every officers to have this, and everybody should have this kit. Now that you are all experts, how to identify a heart attack?
After this, do that person have to choose it?
Yeah, if he is becoming conscious, you can give it. Yeah, conscious person can only swallow. That's a funda. A conscious person can swallow those tablets. Okay, and now that you are experts in identifying heart attack, and you know how to act, you have both of them, and you have the kit in your pocket, you are at office or a community or something, and you suspect somebody, you got a call, somebody is having chest pain, you rush there, it is on the left side, he's complaining, he's spreading over there and he's howling like this, and for sure it's it's a heart attack. But for some reason you are like, kit is there, should I give, should I not give, should I give, should I not give, what will happen, what wrong may happen, if it is not heart attack, something may happen. That kind of feeling will be there. So these medicines are very safe. It has Disprin, clopidogrel, cholesterol tablet and blood thinner. Nothing harm happens. Even a healthy person can chew now, nothing happens. But if that person is going through a heart attack, it saves life. That's the value of this kit. So I want everybody, so I am giving you.
How fast is this going to act?
That's what I said. How fastly you will chew and keep it in the mouth so that the absorption will.
Okay, like for example, if a person is chewing it immediately, so how fast will this?
The best case scenario.
Within minutes. Within minutes, yeah. Because see, there is a saying, you don't apply anything on skin ointments. They are acting on the base that skin mucous membrane absorbs chemicals, drugs. That's how your treatment happens. Even this also, orally tablets absorbs. Through orally also it can go directly.
But after this, they should go and consult a doctor.
By then they should do the evaluation. Yeah.
They should go and
There's something called rescue angioplasty, where if you go in time, actually without any stent, they will do a balloon and clear off the block. Only if you go more than 1 hour, the clot actually becomes stronger and stronger. Then they have to put one spring and open it and put a stent, foreign metal, all this will happen. That is, stent was based on the stabilization of the clot. Otherwise, if you go in time, there is another drug is there, which has to be given IV injection. That if it is given, the block will melt, thrombolysis, we call it. That is not easy to access and give it in a local place. That has to be given in the hospital.
It is strong clot.
So
If it has not become soft.
even if it is in the soft stage of that window 1 hour, it has to be, and it is an IV procedure, so it has to be done in the hospital only. But otherwise, somebody is conscious, the Disprin here will nicely do the same job. Yeah. So please have it and save somebody. There is 1 year life expiry for that, although it is more than that. And make sure to collect the renewable at our clinic for free again. Yes. Please have it.
You can buy and keep the same medicine.
If you know, but the problem is that when we make a kit, calculated. See, if you look at the dose, clopidogrel 300 mg, doesn't come as one tablet. I have to make 4 tablets and put it there, 75 mg. And many workshop I have done, I used to show the photo of clopidogrel 300 mg, that is 75 mg into 4 tablets, atorva 80, 20 mg into 4. Nobody calculate. They will bring either put strips. When you put a strip, on the day of emergency, you don't know how to cut, calculate. So we decided that we will give a kit form so that you open, consume everything and throw it off. And instructions are also there in case you forgot that it has to be chewed, swallowed, all at a time.
Yeah.
Many people after giving it also, should I take all, everything? These questions.
Never thought this would do more than a headache.
Yeah, the headache tablet actually is gonna solve the biggest problem.
And would the heart attack also come and would it be sporadic? Would it appear and disappear, appear and
No,
disappear?
that is called stable angina. Stable angina is the one where at a particular level of intensity, like distance 100 meters or 500 meters, a particular volume of load, when you put it on the heart, it aches. The moment you stop, it relieves. Again you do, again it aches. This is called stable angina, where the spasm block is adequate to block the blood. But the moment you do not load the heart, it is enough to supply it. So in a proper heart attack emergency, it won't happen like that. If it comes, it blocks. It's a time dependent. Minutes, it keeps growing and going up.
How long can you survive if you have a heart attack? Can it go on for hours, 6, 7 hours also?
Yeah, those are depending on the territory. So now like 3 arteries are there. In the entrance it will be bigger, and if it is in the terminal it will be smaller. If the terminal is there, I have seen people who are saying aching from 48 hours. So those people are the ones minor territory. If it happens somewhere in the middle and the top, it's like within 1 hour you have to act. Time dependent heart attacks.
And can you reuse that? I mean, if at all you take that and then you put the electrode on one.
Yeah, these electrodes are like we can remove and ask them to replace it.
Stay calm and follow instructions.
This once it is one store, this is one time usable. Once you saved, you call these guys, they'll give one more.
That's consumable.
This is consumable. See,
Unresponsive.
this is not expensive, which does all the calculations and all that.
Use only if patient is
Then you
unresponsive.
need to attach these electrodes, right?
Yeah, the pouch is designed such a way that it will be always here to act fast. So it has a battery with 5 years of life. I think it can save 5 to 6 shocks. But average AED is never given any shock in reality because people don't have many AEDs to save somebody. Yeah. So you can ask Pawan to have one on the floor. Now that everybody in your office has these kits, you are saving, but you can have this to save one collapse.
There's no positive, negative electrode.
In that, nothing is there. Any two, yeah. This is why government also took an initiative to have defib, and it starts something, people fund, and it's like scam and gone. Nobody take care of it. That's why the government scheme doesn't work in some areas. And help me if you feel. I mean, you didn't attend the major part of the workshop. The workshop was all about how to prevent early heart attacks. The major chunk, I spoke only the 1/4 of my workshop, the end one. So help me connect more offices where I can go and talk. Please take feedback from the people who attended.
Definitely, because now that we are operating out of WeWork,
Yeah.
I can help you connect with the WeWork team. Because there are so many startups.
Yeah.
Of course, there are MNCs also, so possibly we can do something over there.
Yeah,
That can be
sure. This is our NGO's mission to prevent as many early heart attacks as possible, because today in Hyderabad, 80 to 100 heart attacks per day. There are 300 to 400 angioplasties per day, 60 bypasses per day. That's a huge number. And these are highly preventable. In entire India, there are 13,000 heart attacks per day and dying. One single day. And look at this huge number. And all these people can actually, today's people, 80 people who had a heart attack can be screened yesterday and picked up last week, last month. So the more we people learn about this and prevent it, we can, prevent. So compared to the cancer, which is I always feel like when I started my organization, Cardiac Rehab Foundation, I saw that not many NGOs are involved in preventing heart attacks. Some 1,000 NGOs are there towards cancer awareness, and that ranks as a third leading cause of death, not the second also. Heart attacks are the leading one, and not many NGOs are involved in bringing these awareness, prevent heart attacks. So we are So although we are very small, I need help and support from everybody. Help me connect more people so that this information can go to as many as possible. Yeah.
This is 13,000 per day in whole of India.
30,000, yeah, per day.
Per day.
In entire India. Hyderabad is 80 to 100. And these are 13,000 people who did not survive heart attack. This is the death as per 2022. So the number of people survived may be more than that. So the total heart attack should be little more. So as per the statistics, I am giving number of deaths only. Yeah. Any doubts? You are strong and confident that you can handle a heart attack.
Yeah, but I'm not looking for an opportunity to use it.
No, the opportunity, that's what heart attack never comes as such. It comes as always.
I that I never get a chance to use it, but whenever it is, I know that.
Yeah, how to
I have
act.
do it.
Yeah. And most of the time, as I said, many stories, many people are unaware it is heart attack. They keep ignoring. It is a terminal one. The heart attack pumping keeps on going on, and they'll only land up in emergency situation with a big, massive heart attack. And today, if the heart attack is massive, it's called heart failure. The only option left for me is a heart transplant, which is very expensive.
The whole muscle is damaged.
Yeah. This is called pumping capacity. Imagine our heart is a 4 HP motor based on the territory. If it becomes 2 HP, which is half. Say 4 HP motor is pumping 5 liters of blood. After heart attack, within an hour, it is 2 HP, 5 liters of blood. Now what heart has, it's an extra load to pump a big water. So first reflex is, it increases its heart rate from 120, 130 in order to pump that much of blood with limited pump. So on the long term, it strains. So now the only, what we have is, we give medicines called beta blockers which slow down the heart rate, compromising the output. So it says don't strain much. With chemicals, the drugs, we lower the heart rate to 60 to 70, but at the compromise of loss of output and activity. Yeah, so that's where our cardiac rehab role comes in, re-strengthening the leftover healthy myocardium and try to increase its capacity and strength.
So 2 HP can again become 3 HP.
Yeah, 3 HP. Yeah. It's like,
Even though only half the muscle is
sir,
functioning.
in a healthy person, now you are an athlete of marathon runner, your pumping capacity is 5 HP. You know that? That's why, because of adaptation. The same property we apply in a heart which is failing and improve it. And there are heart failures which are called hypertension and alcoholic myopathy. Because of too much hypertension, there is no much damage, but due to a lot of straining, it loses its pumping capacity, collapses, alcohol collapse. Then we can rebuild back. It's very easy to put back. Thank you all. Thank you.